part of a union because you have to have a voice.
Welcome to Union Talk. I'm Randi Weingarten.
In this special episode, we're talking about back to school. And I'm your host, Randi Weingarten, and this is Union Talk. Yes, it's that season of the year when kids are super excited to be back in school, to connect with their friends, and even to connect with their teachers. And teachers are really excited to have school be school again. I've been on the road visiting with kids and families in schools across the country. I see the joy on their faces, and all around I see hope. It's not that we don't have challenges, but after 2 years of disruption and uncertainty, we are laser focused on what kids need to recover and thrive. And in so many places, we're working school staff, parents, administrators, and the entire school community to make sure that kids feel safe and welcome in their public schools and have access to the knowledge and skills they need to succeed in life. So, with that, I want to share with you some key discussions I was part of during a back-to-school town hall held by the White House. We were joined by Secretary of Education Miguel Cardona, Secretary of Health and Human Services Xavier Becerra, White House COVID Response Coordinator Dr. Ashish, CDC Director Dr. Rochelle Walensky, and NEA President Becky Pringle. We were also joined for a minute or two by the First Lady, who's also a teacher, Dr. Joe Biden. You'll hear us dive into issues around teacher shortages, gun violence, COVID, and more. The issues that I hear educators and parents and kids talk about all across the country, issues that matter to students, parents, and school communities, and obviously educators as the school year gets underway. I hope you enjoy the episode and share it with anyone who's interested in how we can help kids and communities thrive. And remember, if you have an idea or storyline of what you want to hear on this podcast, on Union Talk, send us an email at uniontalk@aft.org.
We'll be back after a short break.
They're on their way, on a path to learn, explore, thrive. It's back to school, and this year teachers and parents are returning hope to the classroom and taking politics out, because our kids' dreams are bigger than that. Together, we can lower class size, teach critical thinking and new practical skills, and provide academic, social, and emotional support for every child. We know what kids and communities need. A message from the American Federation of Teachers.
Hello, everyone. Miguel Cardona, U.S. Secretary of Education. So glad and honored to be here with you all on this really important event today. Before I start, I just want to say that this is such an important conversation, and we have so many great leaders gathered here today to be a part of it. I'm going to do my best as moderator to keep us to time so we can get to as many of your questions as possible. So here we are. Welcome to our Back to School Town Hall. I also want to say welcome back to school to all the educators on the line, and thank you for all you do. We're so proud of everything you do for our country. You lift our country. Thank you. I want to thank Randi, Becky, Dr. Walensky, Dr. Zha, and Secretary Becerra for joining today. And I want to thank all of you. Thank you for always putting your students first. As educators, paraprofessionals, school counselors, and nurses, you've been challenged a lot in the past few years in ways you would have never imagined. Our children and their families have also gone through so much. But now is the beginning of a new school year, a time for a fresh start, a time to build on progress, which we know our students are making, even as we understand that COVID hurt students' academic achievement. We have a lot to do, but all of you are people our students need right now. And with unprecedented resources, including through the American Rescue Plan, our students will recover. I'm excited for the school year, and I hope you are too. I'm grateful to have you in the classroom helping students recover. Together, we're going to raise the bar and make this the greatest school year ever. That's why today, we want to hear from all of you and learn from you. Raising the bar means continuing to prioritize our students' health and safety. Through the bipartisan Safer Communities Act, our schools have more than $2 billion to support safe and healthy students, hire school-based health professionals, and strengthen the pipeline into the school-based health profession. There are also tools and resources from the Department of Education, from the White House, from CDC. We have more resources than ever to provide healthy learning environments. Let's use them. Raising the bar also means focusing on accelerating students' learning, not on remediation. Our students deserve our highest expectations for what they can achieve. We must also redouble our work to support students' mental health, their emotional well-being, and other needs. There are unprecedented resources in the American Rescue Plan for Education. Already, we're seeing schools increase students' access to school counselors, mentors, enrichment, mental health services, and other supports. We need even more of this. Finally, to raise the bar in education, we must support all of you, our educators, who are leading our students' recovery. That means elevating the profession, growing a diverse pipeline of quality and qualified teachers and school personnel, providing meaningful professional learning and leadership opportunities, and making targeted investments to keep great educators in our schools. States can and should be using ARP funds to support educator recruitment, retention, and well-being. I call it the ABCs of teaching. We have to make sure that teachers have agency, better working conditions, and competitive salaries. At the start of the pandemic, this administration prioritized educators for vaccines. I'm excited about our work to encourage our union member partners in schools across the country to get a COVID-19 booster this fall. We've also worked to turn public service loan forgiveness program from a promise broken into a promise kept. Prior to this administration, this is real. Prior to this administration, 98% of the loan applications for public service loan forgiveness were denied. Today, we're over the $10 billion mark in loan forgiveness. So please know that you may still qualify. We have a deadline of October 31st. I encourage you to apply before October 31st. And I want to sincerely thank the AFT and NEA for spreading the word about this program. I've talked to countless teachers that have had their loans forgiven, some upwards of $80,000 because of the great work done by AFT and NEA to get the word out. Let's get into this conversation today. There's always something exciting about a new school year. With your leadership, we'll raise the bar and ensure our students are healthy, engaged, and thriving this year and beyond. And now, I'll turn it over to a colleague and friend, someone who leads the White House COVID-19 response. He's a coordinator for that program, Dr. Ashish Jha. Dr. Jha.
Mr. Secretary, thank you. And good evening and good afternoon, everybody. Really pleased to be able to spend some time with all of you. You know, as Secretary said, when the president took office in January of 21, less than half the schools in America were open to in-person education. The president had made a commitment, carried through with his commitment to ensure that kids were back in school safely for kids, safely for educators. And within months, because of the unprecedented resources to the American Rescue Plan and the work of this administration, but not this administration alone, the work that the administration did with school district leaders, with educators, with staff, we were able to get most schools in America back in-person education within months, and able to continue that in the entire year that followed. So I think we all agree that was tremendous progress, and many of the things that we used to make that happen, the Secretary mentioned. And because of that, as we sit here today, thinking about the next school year. I know in many places it's begun. In our household, it begins next week. So that's been the conversation. I reflect back to where we were in summer of 20 and how much progress we have made. We know how to keep people safe. Vaccines are the cornerstone of keeping children, staff, and teachers safe. We have treatments for high-risk individuals. There's tremendous amount of resources for preventing infections in schools through ventilation and filtration. The bottom line is that if we work together, we can keep kids and teachers and staff safe in school, learning in-person education full-time this year. That is both the miracle of science and the policy priority of this administration. And we've been very clear we can't do it without all of you. So thank you for being such strong partners. Really looking forward to tonight's conversation. Mr. Secretary, over to you.
Thanks so much. Intentional collaboration is something that has got us from 47% of our schools open when President Biden took office to over 95% early on and over 99% in about November. It's intentional collaboration. I'm going to give a shout out to Becky and Randi, who from the beginning have been intentional partners, intentional collaborators, speaking for you, lifting up concerns, lifting up voices. But this intentional collaboration is something that we want to continue moving forward. And I got to tell you, here in DC, somebody that I counted on, I relied on, somebody that I knew was an intentional collaborator with me to make sure our schools are open is this next person you're going to hear from. Tough job, but you know what? She's been a partner through and through, and we're fortunate in this country that our schools are open because of the partnership that she's given to the Department of Education. I'm really proud to introduce now Dr. Rochelle Walensky, Director of Center for Disease Control and Prevention. Rochelle?
Oh, thank you so much, Mr. Secretary. And of course, that partnership goes both ways. I'm really happy to be joining everyone this evening. Again, I can't start without expressing my personal thanks to you, Secretary, and to the incredible team at the Department of Education who have been steadfast partners with CDC in making sure our nation's students have the healthiest school year possible. To all the school leaders, the teachers, and the staff joining us, you have my heartfelt gratitude too. That's as your CDC director, that is as a physician, and truly as a parent for your innovation and resilience over the past years that I have seen personally firsthand. You have successfully navigated unprecedented challenges in how you teach, how you help prevent the spread of infectious diseases in your classrooms, and how you created an environment for students to feel connected and know someone cares about them at school. We know that COVID-19 continues to circulate in our communities and requires us to use everything that we've learned to limit exposure and to continue to reduce infections. And that means, as Dr. Shah indicated, staying up to date on our vaccinations, optimizing ventilations in our school buildings, cleaning surfaces at least once a day, washing hands and covering coughs and sneezes, and staying home when you're sick. And this is especially important for protection for those in schools who are immunocompromised, who have underlying health conditions, and who have disabilities. CDC and other federal agencies are closely monitoring also the spread of monkeypox. At this time, the risk of monkeypox to children and adolescents in the United States is low. Many of the steps that you're taking right now to prevent the spread of COVID are the exact same steps that will help prevent the spread of monkeypox. Now, I know there have been concerns about monkeypox, and I want you to know that from what we know right now, this outbreak of monkeypox does not appear to be posing a threat for transmission in the context of casual contacts that typically occur in school settings. Even so, school staff should be aware and learn to recognize the signs and symptoms of monkeypox, and they can help parents and caregivers learn more about monkeypox and what to watch for. You can encourage them to talk to their doctor and to the local health department if they have specific concerns. And all of us must remember that monkeypox can spread through many forms of close contact, and someone with monkeypox should never be stigmatized. So again, we're grateful that you're here tonight. I'm delighted to be here with you. I'm grateful for all that you have done and will continue to do to have the incredible, healthiest school year possible. I look forward to your questions and pass it back to you, Mr. Secretary.
Thank you, Dr. Walensky, for your remarks and for the work you do. Now I'm going to turn it over to someone that yesterday we were together in the White House talking about how to work together, addressing the teacher shortage issue, which we both know is a byproduct of the teacher respect issue that we got to work on together too in this country. I want to turn it over now to Becky Pringle, the president of the National Education Association. Becky.
Thank you so very much, Secretary Cardona. It's good to be with you again. I am so excited, like so many of our educators all over this country, for the start of a new year. Hello, everyone. I'm Becky Pringle, 8th grade science teacher from the great state of Pennsylvania, and I am so proud to represent so many of you as the president of the National Education Association. I want to give a shout out and a huge thanks to our partners at the White House and Randi and the AFT for co-sponsoring such an important and necessary conversation on back to school, the joy of this time of year, and all, of course, the challenges that come with it for educators, for our students, and for our families. A new year always means that fresh pack of pencils, a clean notebook, a pair of new shoes, and every student's freedom to learn in a safe, just, and equitable school, no matter their race, their gender, their identity, or zip code, while we celebrate all that is good and right and wonderful and exciting about our public schools. We know that we cannot ignore the real challenges that we all face that we'll be discussing here tonight. COVID-19, it is a thing and it continues. Mental health issues, gun violence, and the startling educator shortage. As the nation's largest educators union, the National Education Association is stepping up with our members to ensure that there are protections and we have the infrastructure for our children and educators that they both so desperately need to live healthy lives. And we have to be the ones who make sure that that is implemented across this nation. A child who is sick, we know they cannot learn. A sick educator can't teach or nurture our students or drive them to school. Our elected officials owe it to every parent and family in America to ensure the health and safety and future generations. We owe it to them to foster the things that we know that will help them thrive. That's why NEA has put together a series of resources for educators and for families, for lawmakers, for local and state unions, for state leaders on how best to advocate for and support the health and safety of our schools and our students on these issues that we'll be discussing tonight. So please go to NEA.org/healthy schools to get that information. Thanks again to everyone for joining us, and thank you also for submitting the questions that we'll be asking our government officials as we engage in our conversations tonight. I know you are very, very busy people, so we are so incredibly glad that you found some time in that busy day to be with us.
Thank you very much, Becky. Well said, and so true. You know, many of you are already back at school and you put in a full day and you're here with us. Thank you for being with us. Speaking of partners and working together, I'm really happy to introduce our next speaker, who was also at the meeting yesterday at the White House, representing well. And I'll have you know, Randi, that I just got a text from Meriden. They're on the line. They're paying attention. They're doing a good job. Good job there, Lauren. Honored to introduce now Randi Weingarten, president of the American Federation of Teachers. Randi?
I love that Meriden is on the line, which is your home local, and
right.
We love Meriden. And so I want to say to Meriden and the other 3,500 locals we have all across the country, and to all the doctors that are on the line. You know, Becky, you and I are. You know, I'm a history teacher. You're an 8th grade science teacher. I'm still on leave from Claire Barton High School in Brooklyn, New York. But look at the doctors. Dr. Ja, Dr. Walensky, Dr. Cardona, and then we're going to have secretaries and the First Lady. Look, this says to the members and the people who are listening right now that this is really important, that everybody understands that this is a really different year. This is a year that we're really, really, really trying to not just bring normalcy, as Becky said, but to actually help kids recover and thrive. And the administration is helping us. That's why we're having this tonight. And I've been visiting public schools all across the country as the new school year has gotten underway. And frankly, with all the problems, I wish I could bottle the excitement and the hope that students and teachers and school staff and parents are bubbling over with. I saw it today in Washington, D.C., in a school that I was at. After 2 years of uncertainty and 2 years of disruption, yes, we need as normal a school year as possible, but that's not enough because we have to focus, as Secretary Cardona said, on accelerated learning. We have to focus on like a laser on what kids need. And that's why, just like NEA has the programs it's doing, we have done a program called What Kids and Communities Need. And we've also done a school shortage task force report to really try to problem solve about how we solve the teacher and the school staff shortage. But ultimately, the goal is, how are we going to work with families and the entire school community to help students learn, to help them recover, to help them thrive, to help them develop the important life skills like reading, like math, like science, and creating joyful and safe environments. Today was one of the days we gave out books to kids. We've given out over 750,000 books of the million books that we say we're going to give to kids to promote learning. As others are banning books, we're giving books out in diverse titles to help promote learning and the joy of reading. But I'm going to end with this. We know what we've been through. Everybody's been through a lot. Educators are there for our students, academically, socially, and emotionally. And educators have MacGyvered better than MacGyver in the last couple of years. But they need us. They're on the phone. They're on the Zoom today. They need us. And they need that support. And so that's why I'm really grateful to all the administration staff and cabinet secretaries today who are here to answer people's questions, to meet people where they are so that together we can help all kids thrive this year. Thank you, Secretary Cardona.
Thank you very much, Randi. And, like you said yesterday, we support our educators, we're supporting our students. So we're all on the same team. We all have the same goal, and really happy to be here. And I know my colleagues as well. I want to thank the White House also. I know we're going to hear from the First Lady soon. But look, we're on the same team, and we've made a lot of progress, but there's still a ways to go. Look, I'm thrilled. I'm excited dropping off my kids at school. Like, everyone feels good, but we're still in this pandemic. So health and safety is still our priority, right? Health and safety is still a priority. So we're going to transition now to our first panel. Panel number one is going to be on health and safety. So I'd like to turn it over back to you, Randi, because you're going to be asking the first question on health and safety. So let me turn it back over to you.
Thank you. And again, I'm sorry for the amazing sunset in New York right now that is kind of clouding my my Zoom, but it is what it is. And that's what teachers have done all across the year in terms of MacGyvering from wherever they are. So this is my first question. And, it has to do with ventilation. And this comes from people who have submitted these questions, and we want to ask them with the urgency that people have asked us. So this is the question. If I'm unsure what changes have been made in my school to improve air quality ventilation, what should I do about it? Who should I ask? And who or where do I advocate?
Maybe I can get started, Randi, and then we'll see what others have to offer. So first of all, I think we should take a quick step back, remind everybody the incredible importance of ventilation and filtration. This is a really effective way of reducing all airborne transmission of airborne diseases like COVID, of course, but also can help with the flu, can help with RSV. So, and by the way, one of the things that's underappreciated is high quality ventilation filtration improves student performance in schools, because it turns out we all do better when we breathe clean air. And this is one of the reasons why the administration prioritized $122 billion for K through 12 education in the American Rescue Plan to help schools make these improvements. And we are seeing schools across the country do this. I think in terms of what you can do individually, certainly if you're a teacher, talking to your leadership, your principal, your school district, schools can get individual consultations, both from the Department of Energy as well as the Department of Education, have individual programs for schools. So what we have done in the administration is made it very, very clear. Resources are important. Technical know-how is important. We want to be accessible and make sure that for every school district that is ready and committed to making improvements, that there are not just resources, but capabilities available as well.
Maybe I'll chime in if that's okay and say, and maybe just reiterate a couple of things from Dr. Jha. First, again, it's not just about COVID. It certainly helps for COVID, but it's not just about COVID, other respiratory viruses and asthma as well. So many, many benefits of improved ventilation, along, of course, with the other preventive measures we discussed, can help prevent viral transmission in school. We do on CDC's website have a published interactive school ventilation tool. It's available at cdc.gov, and you can enter, once you find out what type of ventilation you have, you can enter the type of HVAC system in your buildings, any other enhancements such as HEPA air filters or an exhaust fan, and you can actually calculate how well the ventilation system is working to protect students and staff in your schools. Again, available at cdc.gov. As Dr. Jha mentioned, there's federal support for improvements in ventilation systems and other resources in terms of consultation that he mentioned. So with that, I'll pass it to you, Secretary Cardona, for anything to add.
Well, yeah, thank you for that. Look, I'm serving as a moderator here and I'm taking notes because it seems like there's more and more updates. I remember, a year and a half ago doing this, some of these resources weren't around. I'll be moderating this section, and then in the second part, I'll be answering questions with Secretary Becerra. But it's a good reminder to look, we have to work together, because when we're talking about air quality, and these are the experts, right? I'm an education person, but these are the experts in health and safety. That's why it's critical that at all levels we work together. So I'll be moderating. We have about 30 minutes, probably about 25 now for this first panel, and we have a series of questions, and I'll be calling on Becky to ask the next question. But I want to let the participants know that this first section is on health and safety, and we have these experts on for that. And then we're going to transition to panel number 2 in about a little less than half an hour, and that one's going to be on academics and mental health. Javier Becerra, Secretary Becerra, and I will be answering questions to that one. So I'll be facilitating this one. So let me turn it now to NEA President Becky Pringle for the next question. Becky?
Thank you, Secretary Cardona. And my question is about the reality that the pandemic, the COVID-19 pandemic, has changed, and so too has the guidance from the CDC, Dr. Walensky, on how to respond to those changes. So could you just please summarize the last update, and please make sure to address when you share that update with us, how we can continue, especially to protect our immunocompromised students and educators and others who we know are at higher risk to COVID-19.
Yes, Becky, thank you for that. And, our guidance has changed both as we've updated our science, but also as our virus has changed. So there are many things that have changed that necessitated this updated guidance. I do want to sort of say overarching, our guidance it very much recommends prevention, and that starts with vaccination. It recommends ventilation, as we just discussed. It recommends staying home when you're sick, understanding when you're sick, staying home when you're sick, and testing. And then, of course, as you mentioned, masking, reaching out to others, protecting and caring for those who might be at higher risk. We did release our updated COVID-19 community levels back in February, and those community levels speak to masking. And so I thought I would actually just focus on some of our masking recommendations, which I know people ask all the time. First, our recommendations are that anyone who chooses to wear a mask should be able to wear a mask, regardless of the amount of infection or COVID-19 community levels, and they should be supported to do so. Our schools and early childhood education programs should consider flexible, non-punitive, non-stigmatizing policies and practices so that individuals who want to wear a mask can wear a mask regardless of the COVID-19 community level. And of course, if our COVID-19 community levels are, I would say, yellow or orange, or as we say, medium or high, we do recommend that people who are immunocompromised, as you noted, or at high risk of getting sick, very sick from COVID-19, wear a mask or respirator that provides greater protection. Certainly schools that have high-risk students, risk of getting very sick from COVID-19, should make reasonable modifications and accommodations when necessary to ensure that all students, including those who are immunocompromised and live with disabilities, are able to access in-person learning. Dr. Jha, what do you have to add there?
No, that's great. And thank you, Dr. Walensky. I'm just going to make a couple more quick points. So we've talked about protecting people against infection. I think Dr. Walensky laid out the importance of doing that. I want to remind people that when it comes to people who are immunocompromised, we have other capabilities of protecting people as well. For instance, I think a drug that we have available, purchased by the US government, widely available and free, continues to work very, very effectively for people who don't respond effectively to vaccines, is the drug Evusheld. It's a long-acting monoclonal antibody. Again, widely available, it's free, and it provides a very high degree of protection against infection. So there are still lots of immunocompromised people who have not gotten it. And then, of course, we're doing everything we can to make sure that people have access to additional doses of vaccines, that they have access to treatments. Again, nothing works quite as well as prevention. It's always best to prevent that infection. Drugs like Evusheld do that, but even if people get infected, we have a lot of capabilities, a lot of tools now to prevent people who are immunocompromised from getting particularly sick.
Thank you. Randi?
Thank you, Becky. So we both, Becky and I both appreciate both of these medical experts and public health experts and the clarity with which you speak about these things. So I'm gonna, and for the people who are listening, both unions also do a lot of advocacy on ventilation. And I particularly loved, Dr. Walensky, you talked about asthma because that is something that's going to be here for a long time, and so many of our kids have it. And it's just really important what good ventilation does in terms of people who are asthmatic. So I'm going to ask the question that I'm sure you get asked all the time for both Dr. Jha and Dr. Walensky, which is, we hear that there's an updated vaccine coming. So what does that mean? Is it a booster? Is it vaccine? Should we get our second booster? I did, by the way, Dr. Jha, after you told me that I'd better do it. But what does it mean in terms of this new vaccine, and what should we be looking for?
All right, I'm going to start because this has been huge on Dr. Walensky's mind all day because she's been overseeing the ACIP meeting, and we have not officially heard her decision yet. So she may be in a cone of silence. I don't know if she is, but another hour, she probably is not. But let me take a moment here to talk about the new vaccines. Before I do, I want to remind people, too many of America's kids are not vaccinated at all. So I want to talk about the new vaccines, the new formulation, but it's worth remembering that vaccines continue to be the most powerful tool we have for preventing serious illness. Look, the data on this is very clear. You're going to hear lots of misinformation that kids never get sick from COVID. Kids are less likely to get sick. That is true, thankful. But kids get sick. We have seen lots of kids hospitalized. We've seen kids ending up in the ICU. The one thing we know is vaccinated kids almost never end up in the ICU. Vaccinated kids very rarely end up in the hospital. So vaccines remain our most powerful tool for preventing serious illness in kids. And I think encouraging children of all ages, 6 months all the way to 17 years, getting vaccinated is very important. Now, let's talk about the new updated vaccine. FDA yesterday authorized this. This is a new vaccine. It's the first major update since the beginning of the pandemic. And one of the key features is it has Omicron as a part of its formula, and that means it's matched to the virus that's out there. It's pretty exciting as far as I'm concerned. And based on everything we know about science and immunology, it should provide a much higher degree of protection against infection, certainly against serious illness and death. We're going to have more data on that in the upcoming weeks. And everybody 12 and over, again, pending a recommendation from Dr. Walensky, which I expect will be coming, but officially she can't say, and I can't ask her to say. Pending that recommendation, everybody 12 and over will be eligible. And I am very clear on this. I mean, my personal view on this is, again, pending that recommendation, everybody over 12 should go out and get it. If you've gotten a booster recently, if you've been infected recently, it's worth waiting. We're going to see what the CDC says about that timeline. But I think other than that, if you've not gotten infected recently, if you've not gotten boosted recently, you're 12 and over, this is a great new vaccine. And again, pending that recommendation, everybody should go out and get it. I'm done. Dr. Walensky.
All right. Well, and just so you know how critically important this topic is of schools and school being open, there's very little I would normally book between the ACIP meeting and my recommendation. Here's what I will say. ACIP just completed their discussion on the updated BioNTech and Moderna vaccines. Again, the Pfizer vaccine will be for those over the age of 12. They voted. Moderna will be for those over the age of 18. That has been voted. Again, a very strong vote in support of this booster dose. So you will be hearing from me likely again this evening soon in perhaps a different venue. Boosters will be coming to our younger people, our younger students soon. So again, this recommendation will be for those just over the age of 12. I do want to sort of reiterate what Dr. Jha said, and that is that if you look over the pandemic at the leading causes of death of children under the age of 18 in every age bracket, COVID is one of the top 5 in every single one, and it is the top infectious cause of death for our young children. So prevention is really critically important. So in terms of boosting, updated booster, add the Omicron, BA5 and BA4 spike protein component. That's what Dr. Jha just said. These, what are called bivalent boosters, contain 2 strains of the virus that restore protection against any protection that might have waned, and they've demonstrated in laboratory studies to provide higher antibody responses for both Omicron specifically and for other SARS variants as well. And I think that that's critically important. So all of that being said, we have boosters that are coming, but to be eligible for a boost, you need to have a primary series. So I really want to reiterate again what Dr. Jha said. Go ahead if your child hasn't gotten a primary series. If you haven't gotten a primary series, no bad time to get one. And if you're eligible for a boost, and more soon to come on that, then go ahead and get your boost as well.
Thank you. And back to you, Becky.
Thank you for sharing that updated information for us and our educators across the country. We look forward to hearing more, Dr. Walensky, very, very, very quickly. So this is a topic that is near and dear to me and so many communities across this country. We know that COVID-19 disproportionately impacted Native people and people of color, and all of the crises that it spawned disproportionately impacted them, and that's been well documented, from them getting it to getting sicker to dying from COVID-19. As you hear so many schools and local districts talk about returning to normal, I have to tell you, anytime somebody says we're going to go back to, I think about the inequities that have existed forever for communities of color, inequities in every social system in this country, which of course find their way to our schoolhouse doors. So as you hear that, schools and districts talking about returning to normal, and that approach being adopted by them. And we know that when we think about it that way, it certainly stands to further disadvantage those particular communities. Can you talk a little bit about what school districts are required to do to ensure that doesn't happen, that we take into account how those communities have been disproportionately impacted, and even beyond any recommendations or requirements, what are you hearing are some of the best practices? Dr. Jha, we'll start with you first.
Sure. I'm happy to start. And then Dr. Walensky, I know will have more to add on this. The pandemic, as you said, Becky, We've all been in this together, but the bottom line is, while it's affected all of us, it has not affected all of us equally, right? It has had a very large disproportionate impact on people of color, really from the beginning. And so when the president came into office, he made very clear to the entire administration, and certainly when I came and joined the team, it was very clear to me that taking an equity approach, an equity-centered approach to this pandemic was absolutely critical. So what has that meant kind of more broadly, and what has it meant for schools? What it has meant is, when we think about the tools and capabilities that we have to provide safety to people, to make sure that people are protected, that they can protect themselves, their families. If you just make those widely available and get out of the way, you're not going to get equal distribution. You're not going to get equal uptake. You have to be very deliberate and focused. And so that certainly has been our strategy when we think about vaccinations, for instance. The vaccination campaign began, and you started seeing those inequities grow between whites and people of color. And we made a whole set of concerted efforts to make sure that people who are traditionally disadvantaged by our healthcare system were getting access to these vaccines. That kind of work needs to continue as we think about rolling out vaccines this fall for children, as we think about these new boosters we were just talking about. It is absolutely essential that we just don't make them available and walk away, that we do everything we can to ensure that people understand why they're getting it, that they have trusted voices, that they're getting access. That same playbook needs to go into treatments. We've been making sure that treatments are being distributed widely, but also that equitably in communities of color. I think on the issue of ventilation we talked about earlier, again, we know which school districts and which schools have been particularly disadvantaged in terms of schools, in terms of ventilation. And so making sure that we're putting extra attention and effort in those areas, really important. I'll finish off just by quickly saying, I've heard Secretary Cardona say this over and over again. People do talk about going back to normal, and I've heard Mr. Secretary say, normal wasn't working out so well for some people. And so the goal in my mind is not to go back to normal. The goal is to build a very different new normal that has equity much more at the heart of it. Let me turn it over to Dr. Walensky to see what comments she has on top of that.
Yeah, I will just sort of add my commitment, which was, I hope, obvious in April of 2021, when we at CDC declared racism a serious public health threat. That is true in our schools as well. I will say in that context that we had 200 departments of public health follow suit after that. So really happy to see more action in that regard. But it's important to recognize that this is going to be a continuing challenge in the future, and unless we actively address it. It's so very important, as Dr. Shah noted, that and Secretary Cardona frequently notes, that normal wasn't working out so well for everyone. And so as we move to this next chapter, as we turn the page, that we need to make sure that students who had challenges before actually don't get further behind, and in fact have issues to capacity to address those challenges. We need to understand that the health disparities and student disruptions and adverse experiences as interconnected problems that schools actually help resolve, that communities help promote and can facilitate the solution. So closing the schools can't be the answers. We know communities of color have been more cautious about reopening. They were more likely to go remote to start. And so we need to provide all the resources that are necessary, as Dr. Jha just noted, to make sure that those are not the areas that are the first to sort of go remote. And maybe I'll just close by saying that our guidance continues to recommend layered prevention strategies and does not recommend school closures. We do have other resources for folks. Dr. Jha has mentioned many of them, but I will turn it back to you.
Thank you. Yeah, and I just want to jump in here. Look, and I think Dr. Jha mentioned it before. In this country, the disparities have almost been normalized, and we've, as a country, almost become numb or desensitized to the fact that in every major indicator there are disparities in outcomes and in access by race and place. So the mindset, the frame through which we look at everything we're doing in this administration is not to go back to what it was. That's not good enough. Is to do better. Whether we're talking about access to health, making sure the American Rescue Plan dollars go to those most impacted. We visited schools that had deferred maintenance on their ventilation system because they didn't have the money. Those are the same schools that didn't open as quickly as they could have. So that leads to poor access. Whatever it is through this, in this administration, we're looking at it through an equity lens. And I think it's critically important that we say that loud and clear and that our actions continue to show that. So when it comes to vaccination, communication, making sure American Rescue Plan dollars are being used to address the inequities that were exacerbated, it's on all of us to work together to make sure that happens. I think we have enough time for one more question in the first panel, and then we're going to transition to a couple other things. So Randi, you're up.
Great. Thank you. So I'm going to ask this question of Dr. Jha and Dr. Walensky, and it is the reference to monkeypox that you made earlier, Dr. Walensky, which is, anytime somebody hears about a new disease or a new virus, there's immediately, what does it mean? People are scared. What is it? What are the risks? So how should schools minimize the risk of students and educators to contracting monkeypox? And what are the recommendations or the requirements, both in terms of prevention, but also in terms of reporting of monkeypox or COVID-19 within each school building? What do people need to really know?
Let me start, but I know Dr. Walensky is going to have a lot more to add here. So first and foremost, I think we should be clear about the fact that monkeypox spreads very, very differently than COVID. This is not COVID. It's a very different virus, very different disease. And based on everything we know about the current outbreak that's happening in the US and around the world, based on everything we know, students, educators, school staff, the risk is extremely low because almost all of the spread we have seen has been largely among men who have sex with men, gay and bisexual men who have sex with men. And it's been through prolonged skin-to-skin contact or through sexual activity. So there's sort of casual contact as a way of spreading monkeypox, while theoretically possible, has largely not been a feature of this outbreak. Again, we always have to be humble. We can't say that'll never happen. We're not going to say that nothing can ever change. But I think it's really important to understand that this is not, schools should not be considered a high or even a medium risk place for monkeypox to spread. And let me just finish by quickly saying, obviously, still important to stay vigilant, recognizing symptoms, recognizing the characteristic rash, making sure that if you see something that you suspect, that you work it up and not ignore it. Those all remain really important things. Dr. Walensky, I'm sure will add more to that. But I want to start off by reminding everybody, very different virus. Schools are a really low risk situation. Dr. Walensky.
Great. Yeah. And I will maybe just reiterate some of that. At this time, from what we know, the risk of monkeypox in casual contact in a school setting to children and adolescents and to adults is low. That's what we know right now. We are not seeing transmission occur in those kinds of settings. School and early education programs really should just continue the same steps they're implementing to prevent the spread of infectious diseases in general. Now, folks are really attuned to those. We're recommending students and staff stay home when they're sick, including when they have an undiagnosed rash. They should stay home and seek medical care if they have an undiagnosed rash. We're encouraging hand washing, encouraging routine cleaning and disinfection practices, nothing like we recommended early on in the pandemic, but routine practices, identifying spaces for children when they're sick or children who might present with a rash when they're at school. Where do they go? What do they do? And then provide disease-specific personal protective equipment for all staff who are caring for children with infectious diseases, your nursing offices specifically. If a student comes in with a rash or a staff member comes in with a rash that may be monkeypox, we need to work with the Department of Health to understand how that could be diagnosed, how we might do contact tracing, and importantly, never to stigmatize. Because while most of what we are seeing is in men who have sex with men, there are some occasional risks or contacts that are occurring outside that setting. We want people to be aware but not alarmed, so that they know what they should do if they come into contact with it. Again, notifying student staff members, families of a case, doing the appropriate contact tracing, not being stigmatizing, not being alarmed. We have resources. I do want to make sure folks know that monkeypox is a nationally notifiable disease. CDC encourages schools to collaborate with their local and state health departments to determine if contact tracing is appropriate, to determine the next steps. And then, of course, to view our monkeypox webpage for schools and early care and education programs for answers to frequently asked questions. We know you have questions. Many of them are available on our website. Thank you.
Thank you.
Thank you very much, Dr. Walensky, Dr. Jha. Look, this is an example where, you came together on this call. We know not only today, but whenever we have questions, whenever we have needs, you're available. That's what intentional collaboration is. That's how we're going to get through whatever challenges we have. I really, really appreciate, I know you had a really busy day, so really appreciate the time with us here today, your insight, your expertise, and your partnership. Thank you, Dr. Walensky. Thank you, Dr. Jha, for your time today. Have a good night. And now I'd like to introduce a lifelong champion for students and educators in her more than 30-year career as a classroom teacher and a community college professor, and as First Lady of the United States. It's truly my honor, my privilege to turn the program over for a message from Dr. Jill Biden.
If you're anything like me, you love the start of a new school year. There's a moment right before my new class files in when I smell the scent of freshly waxed floors drifting in the air. I feel the fading glow of the summer still warm on my skin, and I hear a hum of possibility in that fragile quiet, just waiting to be pierced by the chatter and laughter of new students bursting through the door. In that moment, the year seems to stretch out in front of me. I know that I'm about to meet students whose lives I might change forever, or who will change me in their own way. I know that we are going to grow and discover and learn together. And I feel lucky to be a part of the tiny miracles that happen in our classrooms every day. This job isn't easy. And there are times when we are going to feel tired and frustrated. But I hope in those moments, you can hold on to the sense of possibility that so many of us feel right now. What you do matters to your students, to your communities, to all of us. Never forget that you are changing lives, that you are guiding the next generation, that you make miracles every day. Thank you.
Thank you, Dr. Biden. It's always great to hear from the First Lady. Look, it's great to have a teacher in the White House, that's for sure. Always inspirational and really a true champion for educators across the country, for our students. And speaking of champions for our students, I want to introduce a partner that from day one, when we started in this administration together as secretaries, he's been a partner, somebody I could pick up the phone and call, and has really showed that at the federal level, Health and Human Services and education need to work hand in hand. My pleasure to introduce to you Secretary Xavier Becerra. Javier?
Secretary Cardona, thank you very much for everything you're doing to make sure that the return to school, that for our children, for our teachers, for our school personnel, that everything is, as you said, going to the next level. And I very much appreciate the partnership, the friendship. We have had an opportunity to do a number of things together, many of them because we've been pushed by the First Lady, Dr. Jill Biden, who has made education such a pillar. And we're fortunate to have the opportunity to work so closely with Dr. Biden on so many occasions. But she's tenacious. And I think because she's been an educator, as you said, this is something that she wants to make sure that the White House moves. And fortunately, she's got a great partner in the White House who wants to do the same thing. And I know for the Department of Education, like the Department of Health and Human Services, President Biden has been tremendous. And I'm about to mention some of the things that he's made it possible for us to do. But he has made it a clear priority. And anyone who heard his State of the Union address knows where President Biden's values are. Because when we talk about budgets, we really are talking about values. And we have never seen a president dedicate so much money, so many resources, and so many authorities to tackling not just healthcare, but in this particular case, behavioral healthcare, mental healthcare, as President Biden has put before us. And we started a nationwide tour as a result of that to go out there and talk about how the Biden administration is really working to try to tackle the concerns of families throughout America. So to you, Secretary Cardona, to Dr. Biden, thank you so much for really championing this cause. I want to thank, of course, my colleagues, Dr. Walensky, Dr. Jha, who spoke earlier, everything that they've been doing to try to help American families really feel safe and feel like they can thrive. We need that. And it goes without saying, the people who do the work on the ground, to both the Federation, American Federation of Teachers, and the National Education Association, I simply want to say thank you so much for everything you do every day to educate our kids. Thank you to all those teachers who are now, of course, retired, who helped me be the first in my family to get a not just a high school diploma, but a college degree. And I've been very fortunate as a result. And it's because there were a whole bunch of people who were dedicated to making sure kids like me had a chance to get educated. So thank you to all the teachers, including your bosses, of course, who are on this line, who make it possible for us to all thrive. More than 40% of teenagers have essentially told us that they struggle with persistent feelings of sadness and helplessness. More than half of parents and caregivers have expressed to us, all of us around the country, of their concerns over their children's mental well-being. This is real, and COVID has made it even worse. That's why today we are pleased that we are announcing more than $40 million in youth mental health grants throughout the month of August. We also announced today that we're making more than $47 million available in new grant funding opportunities that help develop the opportunities for schools to do a better job of protecting our kids and providing them with the health care they need. That was a result of the Bipartisan Safer Community Act that we have those extra dollars. We're going to make full use of that. We hope you do as well, because those dollars can go to all sorts of programs. Project Aware, which I know so many of you are familiar with, that lets us actually put the professionals, the people who caregive in schools, to provide the services, to provide the toolkits, to provide the guidance that the schools need to get going. It also will go to mental health awareness training grants, so we can train up the people who will provide those mental health services. In the last year alone, it's actually about a year and a half, this administration has dedicated more than $1.5 billion across the Department of Health and Human Services to invest in youth mental health services. That's a game changer. That helps us do things like support 988, the new transition that we've had now from a 10-digit phone number to help anyone in America, but certainly our youth who are suffering from real depression, anxiety, and some thinking of suicide. Instead of having to dial that 10-digit number and a different number depending on what region of the country you're in, today, just like 911 lets you have emergency services, 988 is the 3-digit lifeline that helps you go to a place where we can prevent that suicide and get the services that you need. That was made possible because of the funding. President Biden has given us more than $340 million in the past year and a half for a program that before he came in got essentially about $18 million in the previous year. And that's why we can do these kinds of things. And it's working. 41% increase in the volume of calls that are being received at the Lifeline, now that it's 988 compared to a year ago. 46% improvement in the number of calls that are answered when people call. 170% improvement in the number of chats that are answered, because it's not just phone calls, it's texts and chats as well. And a 675% improvement in texts that are answered today. And we know that young people really prefer to use text and chats than they do phone calls. I would make use of the phone, but they like to use the electronics. And so we are going where they are. In August, we also released new Medicaid guidance to maximize school-based health services. And thanks to the Bipartisan Safer Communities Act, as I've mentioned, we are making a critical investment in building the youth mental health system and to strengthen Medicaid services for kids and to advancing school-based health services. In the coming future, and we hope sooner than later, but sometime next year, we hope we're going to be able to roll out the information that will help schools actually know how to qualify to get reimbursed for providing services to kids who qualify for Medicaid. And so we're going to move. And we hope you do what states like Virginia have done to implement Project Aware, where now, because of the grant funding we provided to the state of Virginia, they're able to put a mental health professional who is employed right there at the school. And they're going to do this test model for about 18 schools in their state. They're going to be able to train teachers so they can actually have the practical strategies on how to take care of the mental health needs of kids. And they're going to actually use some of their resources to provide therapy dogs that provide services in elementary, middle, and high schools in some of the counties in West Virginia. All of this is going to help. We know that we have much more to do, but in partnership with all of you, we think that this is going to be a game changer. We're looking forward to working very closely with the Department of Education, with our colleagues in the teaching world, and of course with families throughout. So, Secretary Cardona, I turn it back to you.
Thank you very much, Secretary Becerra. And, you just listed a bunch of things there that demonstrate that when the president's talking about addressing the mental health crisis, it's not just words, it's actions. So thank you for your leadership there. Obviously you could tell we're transitioning now to the second panel. We'll have about half an hour to talk about academics and mental health, which is a topic that I know educators across the country, they're not separate, right? They're one, really, because you can't get to one without the other. So I'm going to ask Becky to ask the first question, and then Xavier and I will be the ones responding on this panel. So Becky.
Thank you. And Secretary Becerra, welcome. We're so glad that you've joined us in this space with so many educators. And I'm sure I would speak for Randi when I say we are not our members' bosses. They are our bosses, both of them. Both the NEA and the AFT had huge conventions this summer where thousands of educators came together and gave us guidance and directions by passing policies about what the NEA and the AFT would look toward this coming year. We're so glad to have you here and to be in partnership with you. Both of you know that mental health is at the forefront of educators' minds. We got lots and lots of questions about the mental health of our students and of our educators and the supports that are available to them. So can you both of you talk a little bit about how the federal government is addressing mental health needs of both our students and our staffs, and how we can address the social and emotional and mental well-being for our students to be able to learn and our educators to be able to teach and nurture and support our students?
Why don't you kick us off, Secretary Becerra?
Will do. And President Pringle, thank you for the question, and thank you for the work you do on behalf of all those teachers. You're right. What you just said about being the boss is that what I hear when I get home. I know I'm not the boss, and so I know who I work for. Let me just say this. You heard from Dr. Jha and from Dr. Walensky, so much of what we're trying to do to make the workplace, the school setting safe to begin with, because it's hard to help people with healthcare services, mental health care services, if the workplace, if the school setting isn't safe. And so one of the first things we got to do is make sure that we make the tools available so that every child arriving at school, every teacher, every school personnel knows that when they get there, it'll be a safe learning environment. So that's one of the first things we do. But secondly, as I just mentioned, the president made it possible for us to make game-changing investments, still not enough, but game-changing investments. One of the critical areas that he pointed out is that so many of our kids, about half of our kids qualify for Medicaid services, but yet so many of them never receive the service when they could actually get it easier at a school. So we're going to do everything we can, working with Secretary Cardona, to see how we can make it easier for schools to qualify as one of those healthcare providers so that we can make sure that kids in the school setting, rather than have to go all the way to the doctor or some healthcare facility, can actually receive some of those healthcare services. And I mentioned all the some of the investments that we've made, and we can go into detail on some of those. But let me kick it over to Secretary Cardona.
I appreciate that. Look, that's a game changer right there, right? And I think we got to stop thinking about mental health support after the fact. Look, let's not wait for trauma to happen for our students. Let's not wait for the behavioral outburst. Let's not wait for the breakdown, the disengagement before we treat it. Our kids are telling us they need help. We need to be proactive and provide a foundation of support. And that means like unapologetically challenging 500-to-1 ratios with school counselors or school social workers and students. Like, again, we've normalized that. And we're shocked when we have exclusionary practices that push out students that are in trauma. The Bipartisan Safer Communities Act puts $2 billion into our schools to address mental health needs and many other needs through Title II. But there's real money there to make sure that we're not just adding one or two. And, look, we got to fundamentally shift how we're providing support to students. The mental health support access needs to be a foundational strategy. It can't be left for after the fact. The American Rescue Plan, we've been talking a lot about making sure that those monies are used now, because kids are in crisis now. Families are in crisis now. Our educator workforce is in crisis now. I mean, we're welcoming students, over 150,000 students that lost a parent or primary caregiver. They're coming back to our classrooms this week. They're going to need help. So if we don't fundamentally rethink the role of mental health supports in our schools, we're going to be putting Band-Aids on a bigger issue. I visited a school in Michigan, high school with 3 campuses, 6,000 students, 8-period day for every student. They changed the schedule for every student to make sure that every high school student once a day has 1 period dedicated to mental health supports or social emotional well-being. 6,000 students. That's a fundamental change that's going to affect every child. All right. So I know it's not easy work, but you know what wasn't easy? Reopening schools in the height of a pandemic. So we can do this. We just got to shift the urgency to address this mental health crisis that we have in our schools. So first, we got to acknowledge it. We got to use the money with intentional collaboration, intentional partnership, voice of different stakeholders, including our parents, including our students, to make sure that mental health supports is not a stigma, that it's something that we do now, just like we feed children when they're hungry, like we teach children how to read when they need that. So we need to just really revisit that. And that's at all levels, right? I'm talking to teachers here. I'm talking to people that get this. They've been saying this for years. We need to make sure our board policy or state policy that we are viewing mental health support access as a basic need, or else we're going to be dealing with the consequences of lack of mental health supports, and that's more expensive, and that's traumatic. Now is the time. The system was disrupted for us. Let's not put it back together the way it was before. Mental health supports have to be a foundation. The Bipartisan Safer Communities Act, the American Rescue Plan puts more money into it in the span of a year and a half than we've ever had in my over 20 years of education. So now is the time to get it done. We just got to keep pushing with the same level of urgency we did to reopen our schools.
Thank you for those answers. Randi?
Thank you, Becky. And, I'm really glad you also answered the question about our 2 conventions, because our members, and the secretaries know this, our members are amazing. And, if you want to actually, listen to what's real, just go to an NEA or an AFT convention and talk to the folks in the hallways or in the, as they really, 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 debate these kind of issues. And I think that they would love the people who are on the Zoom, as well as, so we get so many questions, Secretary Cardona and Secretary Becerra, about this and about how we access these funds in a way, like how are we and parents together able to access these funds to make sure that we don't have the status quo, that we can actually wrap services around. And that kind of leads me to an
academic question, because we're going to ask the same thing about academics as we are about the mental health supports, which is, and today it's pretty timely to ask, given the NEA results are out today. So we know that COVID-19 has affected every aspect of our lives. And we know that it was unprecedented. And we know that we know a lot more now, and we have a lot more tools now than we did 2 years ago. And the twists and turns and all of that, both in America as well as globally. And we're going to get a lot of results that show that this disruption really hurt in so many different ways. And I think the NEA results today were one of those indications. So the question really is, and I'm going to use your words, Secretary Cardona, that you have used with us over the course of this last year, how we accelerate learning. So our goal this school year is we really have to help kids recover and thrive. We know we need a welcoming and safe environment to do that, but it is about the academics. So how, give us some suggestions. We have some ourselves, but some of the suggestions that we should do over the next few months to help our kids accelerate learning.
Yeah, look, so a lot of I got a lot of questions today. I did a lot of media hits about the NAEP scores, the drop. It's, to me, a symptom of two things. The impact of the pandemic, and it's disproportionate, right? It exacerbated achievement disparities. So it's the impact of the pandemic, but the impact of negligence of the last administration too. All right. I was a commissioner, crickets. All right. We were on our own to get stuff done. When the president got in, right? American Rescue Plan, within the first couple of months, we went from 47% of our schools, not even more than half of our schools were not open full time. Only 47% of our schools were open full time when the president took office, right? To over 99% in November. So the president took office in January. By March, he was saying that educators are going to be able to line up for vaccinations early. I remember that summer, by July, we were hearing about 90% of our educators were vaccinated. That's why our schools were able to open, even with Delta and with Omicron. All right. So look, you could tell I'm getting pretty passionate here. I don't like it when students are not at their best, but I know that we have the strategies to turn that around and accelerate learning and reach higher levels, better than, because the data weren't great before the pandemic. $122 billion directed toward our schools. And we required that the state submit plans that have equity and stakeholder engagement at the heart of their plans. All right. We wouldn't disperse the money if their plan didn't have equity and stakeholder engagement in there. All right. So putting the funding there and making sure the funding gets to the classrooms. That's why we required districts to put their ARP plans in a public place so that we can have parents, families, educators, ensuring that the money's going to where it should go. So in terms of academic recovery, look, we know, how about funding our schools adequately so that we have enough teachers, certified teachers in the classroom. We have decent class size, okay? Decent class size where teachers can work with students and provide them the individualized support that we know that they need. Making sure we have enough school social workers and psychologists. We talked about teacher work conditions, right? Teacher work conditions means I have teachers that are focusing on helping students with academics because I know the school has ample resources to provide them the social emotional support that they need. So working conditions, making sure that we have teacher retention strategies, right? Because if teachers are not getting a competitive salary, they're constantly going to be looking. So making sure we have a robust educator workforce in those schools, providing reading instruction. Look, we know how students learn how to read. Let's go to that. Let's focus on giving our teachers time in the classrooms to teach students to read and focus on that, math, engaging high quality core instruction, good high standards, high expectations, a teacher that believes in children. I could go on all day about this. I'm going to give my colleague Xavier had a chance to talk about, look, we got to strengthen our schools and make sure they're fully resourced before we start complaining that they're not doing their jobs.
President Weingarten, let me just focus on one small aspect of this. We cannot afford to lose another professional at a time when our schools are starving for more teachers, more professionals who can help. And while HHS has its focus on healthcare and not on recruitment and training of the next generation of teachers, what we're trying to do is help keep teachers in the profession instead of leaving after 3 years because of burnout and all the rest. And so early on, for example, in the spring of this year, we put out $100 million to help with workforce resilience because we knew that there were a lot of sectors that were seeing their workforce burn out, and teachers are among those. And so we're going to do what we can to help keep the workforce in place, get them to believe that we feel all the difficulties they've gone through, and try to make it so that they believe that they're in the right place, making a difference. We're also going to try to really focus on particular initiatives that let us do things in the classroom, in the school setting. I mentioned Project Aware. That's one way that HHS can land in the school-based setting. We will do what we can to try to make that happen. But more and more with this emphasis, at least under President Biden and Vice President Harris, on behavioral health, we think we can make a big, big difference if we can get schools to feel confident that they can participate in the Medicaid system, because that will guarantee funding that will help those schools have the resources they need to have the personnel who can help kids. And by the way, help teachers as well. So we're hoping that we can make progress on that. And Randi and Becky, we're going to be looking for your leadership to help us make sure that we do it the right way.
We totally love that about, how we do this the right way, Secretary Becerra. We've wanted, it's your vision and this administration's vision to get this done. This is something that we've wanted to do for literally years. So thank you. Back to you, Secretary Cardona and Becky.
So the question that, of course, is on everyone's mind, can both of you talk a little bit about what the federal government is doing to address the teacher and the school staff shortage that is happening all over this country?
Well, let me jump in on this one. It was good to see you yesterday at the White House, in that roundtable meeting with the First Lady, with Randi and others, to discuss again, how we're going to work on this together, how we're going to problem solve together. And I think, it's a key ingredient. I've said it before with reopening schools and now whatever we're dealing with in education, it has to be collaborative. We have to get different perspectives. That's what worked to reopen schools. That's what's going to work for us to get through this. Short-term and long-term solutions. Short-term, we have American Rescue Plan dollars. We're strongly encouraging teaching bonuses, making sure that educators, I talk about a teacher respect issue. Like, we have to address it. We have to address the compensation gaps. College graduates in other degree areas earn on average 33% more than teacher graduates. That's unacceptable. It's unacceptable for us to expect teachers to, after a busy week, and it doesn't end when they walk out of the building. Teachers oftentimes take work home with them. For teachers to have to work on the weekends, driving Uber or waitressing to make ends meet, that's unacceptable. So short-term solutions, make sure we're providing the salary that keeps them in the classroom and shows them the respect that they deserve. Improve working conditions, I mentioned before, ensuring that there's adequate staffing, ensuring that teachers have agency and autonomy. They're professionals. Let's start treating them like professionals. So with the American Rescue Plan dollars, salary bonuses, bringing back retired teachers without penalty to benefits is another way to address it short-term, but also long-term. I mean, Becky, we talked about this yesterday. Let's make sure we're doing real grow your own programs. We have tremendous paraeducators who've chosen to come into those schools and work hard. And, we don't often respect our paraeducators as much as we should too. They do critical work. When I was a school principal, I relied so heavily on the paraeducators in our schools. So maybe create pipeline programs and use ARP money to provide them incentives and pay for some classes so they can go on and get their credentials. And to grow your own program, we should start thinking about apprenticeships in every state. Tennessee's doing it now. We need models where the teaching profession can become an apprenticeship so that we can get our pre-service teachers paid. This idea of teaching for 4 months without getting paid as a student teacher, we got to revisit that. What other profession are you working for 4 months for free? We need to start thinking about that. We have more money now with the American Rescue Plan. We need to be innovative. We need to make people want to become teachers. All the money in the world's not going to help if we're not showing as a country respect to our teachers. Who's going to want to come into a profession if we're not respecting and elevating this profession? No other profession is possible without educators. We know that. Let's start showing it in our policies, in our compensation, in our working conditions. It's the best profession. Those of you on the call know it's the best profession. So what we need to do is, number one, respect the profession, elevate it, provide better compensation, better working conditions, and provide agency for our teachers. That's what they're asking for.
And I sort of answered Becky this question a little bit in my previous response to Randy's question, because we don't have direct jurisdiction over things like teacher hiring and recruitment and training, but we want in. We want in. This is too important. And there are aspects. I mean, the fact that so many teachers don't stay in the profession is one of the things that we can really try to help tackle, because why should we lose some of our best and brightest because they feel burnt out or they don't make enough money? And what we want to do is partner with Secretary Cardona, with all of you, to figure out ways that we can make those who committed to teaching something that will be lifelong. And so that's where on the HHS side, what we can do is we can help with the issues of burnout. We can help with the issues of access to good services. We can help to make sure that the kids that you're trying to teach come to school ready to learn instead of carrying a lot of trauma or stress into the classroom. And we can provide some services. Project Aware, which I mentioned earlier, is one good example. But I will be honest with you, for us at HHS to get healthcare in to help you with all of these things that will help make teachers not only proud of what they do, but long living teachers, is to make sure that we can get the assets, the resources into the schools. And for me, for HHS, that means working to succeed on Medicaid into our schools, because that will provide the steady stream of funding that the schools need. You and I know that so often the issue you run into in the school district is, hey, we're out of money. We can't pay more, or we can't do the extra training, or we can't provide that teacher with the extra support because we're out of money. We need it for the 3 R's. We're going to try to say, wait a minute, we want in, we can help. And one of the ways is, instead of spending so much of your own money, school money to help a kid that you know you need to help stabilize, they're having some trauma or some stress, get reimbursed for that if the child is Medicaid eligible, and just let us help you know how to run through the system so you can qualify. Right now, it's very difficult for schools to know how to navigate this. They're not healthcare providers. Right. They don't know how to check all the boxes and submit all the applications. We're going to try to do what we can to streamline this so that if you are actually providing care, you get the money you deserve if that child was Medicaid eligible. I think that's the biggest game changer we can provide, because we want in.
That's significant. And, let's make that happen. Let's continue to work together. I really appreciate that. And another thing that we're going to do, we're going to make sure our Office for Civil Rights keeps protecting the civil rights of students, because what I'm hearing too is teachers are not wanting to be a part of a system that discriminates against students. So we're always going to do that. But look, you're the experts out there. So I know Becky and I know Randi, you have thoughts on how to address this teacher shortage issue too. I'd love to hear yours.
So it was so good to join you yesterday, Mr. Secretary, to hear from you, to hear, of course, from our First Lady, who is an NEA member, and from Secretary Walsh as well, to talk about what you know is true. There is a shortage. There's a shortage of professional respect for our educators, of resources and funding, of professional pay, of protected planning time. We hear that all the time from our members all over the country. They need time. They need time to teach. They need time to nurture our students. They need time to collaborate with each other. They need time to call parents and partner with the community. They need time. They need support from their administrators. They need time for a better work-life balance. You talked about them taking all of that work home and working on the weekends and not necessarily having that time to take care of themselves and their families. And we know that in the end, it's our students who are being shortchanged. They deserve more, they deserve better, and so do our educators. As we think about those solutions, we have but to listen to our educators because they are telling us what those solutions are. It is not a matter of whether we have the wealth in this country. We all know it's about whether we have the will to make sure that educators are seen and respected for the professionals they are. Randi?
Thank you, Becky, and thank you for all of that. Look, we have lots of different ideas. We talked about some of them yesterday, and I was just like Becky. I'm very gratified that we had, in the span of 1 week, we've had 3 administration secretaries, cabinet secretaries, talking to us about issues that are really, really, really important to parents and teachers on behalf of our kids. Parents and teachers together are key to our kids' lives, to their futures. And so it's been an honor to, see and work with this administration, to have the First Lady, essentially the first teacher. And so that respect, I start there because that respect, that honors what parents and families have to do all the time. It hasn't been easy in the last 2 years. And both of you know, through all your life's experiences, as does Becky, as do all the teachers who are on this Zoom, it's not been easy, not just the last 2 years, but the inequity, the injustice, the lack of opportunities, the lack of a level playing field. And teachers, essentially are the first responders to all of this. And what they ask for is they ask for respect. I often tease that should not be just a great Aretha song. And people would want to be teachers if they knew they'd be respected. Very few teachers thought that they were going into teaching to be social justice warriors. But then when they can't teach, I'm a social studies teacher, the Diary of Anne Frank. You can't teach about Ruby Bridges. You can't answer questions of children. You have to be mask police. That has been what has created some of the burnout. And that's not parents, that's politicians. Because parents just want the best interest or want the best for their kids, and so do teachers. So this idea about changing conditions so we can meet the needs of kids, we can have fewer kids in our classes, we can wrap services around schools, we have less paperwork, so we can have more focus and attention on what we're doing in school, capstone projects, having the kind of freedom to teach and freedom for kids to learn, and also having salaries so that people can raise their families in the communities in which they live. We know your home state, Secretary Becerra, such a housing crisis, and that's, and teachers are leaving because of that. I know that in terms of LA. But in other places, it's the student debt crisis. In other places, like West Virginia, because of the hiking of health insurance costs, people are making less than they made a few years ago. Same in terms of Texas. So we have to do several things at the same time. And in our convention, we passed a task force report
where we talk to teachers and school staff all across the country about the kinds of things that they needed. But it doesn't cost any money to create respect and to create agency and this kind of community of parents and teachers together, where we are doing what is so important to help every other profession and occupation and help our kids have that kind of skill and knowledge, empathy, critical thinking, so that they can seize their dreams. Thank you for the question.
Yeah, that's great. Look, I love those responses. And I think, for those listening, there's tremendous overlap in what we're saying here, which shows that we need to continue to work together. And I know, our time is up tonight, but I want to say this to the panelists, like, this is what our country needs too, right? There's no shortage of good ideas, but what good are the ideas if we can't work together to accomplish them with the shared vision of making this country better, right? Giving our students opportunities, making sure, because we know we invest in our schools and our educators, we're investing in our students. That's our collective task. And the President's been very clear. He expects March 2020 is the baseline. That's not the goal. That's the baseline. We have to do better, and together we will. So to the folks that are on the call, I want to thank you for joining. Look, there's so many other topics. We want to make sure we're fighting, we're working with you, we're listening to Randi and Becky about gun safety and making sure that our schools are safe, right? That they're safe. We're going to continue to do that. We're going to continue to listen. I want to just share with everyone that it's because of your leadership and your style of leadership to bring the tough questions to us and make sure that you're working with us, that we're able to be responsive. That's why when the President acts on education, it's driven by your members' concerns, questions, and needs. We're going to continue to do that in the Biden-Harris administration. We know, and I know Xavier knows this because we hear it when we hear the President, when we hear the Vice President. It's our obligation to not just go back to how things were before the pandemic, but to be better. Randi and Becky are a big part of that. Xavier, myself, Dr. Walensky, Dr. Jha, we're all on the same team. I want to thank everyone sincerely. I want to thank Mary Wall, Haley on our team at the Department of Ed, and everyone from AFT NEA behind the scenes that are making this possible for all of you. Becky and Randi, thank you for your leadership, your partnership. This is going to continue. I mean, this was good to do this, but the real work happens in between meetings, and know that we're going to continue to partner because we know we're going to be a better country because of it. Thank you, everyone. I hope you have a great night. And we want to make sure we leave enough time for you to get ready to watch the President speak. He's speaking soon. So thank you, everyone, for joining and for being a part of this partnership. Have a good night.
Night.
Good night.
Night.